So at this time, I'd like to take the opportunity to introduce Dr. Sandhu, and he's the president and chair of the Royal College of Dental Surgeons in Ontario. And Dr. Sandhu brings decades of leadership and dedication to the dental profession, a very respected figure in Canadian dentistry. Now, Dr. Sandhu has made significant contributions to education, regulation, and community service. He has served as the Dean at Western University at the Schulich School of Medicine and Dentistry, where he also held roles as Chair of Admissions, Chair of Periodontics, and the Vice Dean as well. He was instrumental in launching the DOCS, which is Dental Outreach Community Service Program, which expanded access to care for underserved populations. Dr. Sandhu is a passionate advocate for accessibility in oral health care and was recognized in 2013 with the Queen's Diamond Jubilee Medal for his service to the profession and the community. He maintains an active periodontal specialty practice and has published numerous papers on clinical outcomes of periodontal procedures. Audience in person and those online, Dr. Sandhu will be presenting virtually. Please help me welcome Dr. Sandhu, our next speaker.
Thank you very much for a kind introduction. Good morning, everyone. Thank you for having me here today. I'm honored to speak to this group. You are the people who make a difference. You help internationally educated health professionals build new lives in Canada. Your work really matters. I have been introduced as president of Royal College of Dental Surgeons of Ontario. I'm in my second term now. We are the regulatory agency for dentists in Ontario. We set education standards, produce guidelines and standards of practice, and provide a complaint and investigation process for the public. Before I go into various pathways for internationally trained dentists, I should tell you something about myself. I am an internationally trained dentist. I understand the journey. I have lived it myself. I came to Canada in 1975. At that time, I had already practiced 2 years in India at a government health center after completing my Bachelor of Dental Surgery from Guru Nanak University, Amritsar. However, in Canada, I discovered that my degree from India was not recognized. I had to work very hard on myself to integrate into the Canadian system. Earlier, Dr. Santos have mentioned it is not only important what you know clinically, but I think integrating in the system is very important. Language is important, getting along with people and interacting with other professionals are the key ingredients for success. So I was very fortunate that I got a Medical Research Council of Canada fellowship to do a PhD at University of Ottawa, and then a periodontics training at Loma Linda University, California. So this education opened the doors for me to become a periodontist and an educator, but I did go through some national board examinations in US as well. So my clinical training was assessed through my postgraduate training and some examinations. I want to focus now on experience that internationally trained dentists have today. These are skilled professionals who trained outside Canada. They want to practice dentistry. They deserve our support. The challenge we face, Canada will always need dentists. We have an aging population. We have growing communities. We have a new federal program for lower income Canadians. Access to dental care is a real issue in many areas. It can be a geographic challenge and a financial challenge or both. At the same time, we have talented professionals from around the world. They want to contribute to our healthcare system. They want to serve our communities, but they face barriers. These barriers can be unnecessary. They slow down the process, they waste talent. This is not just an Ontario problem, it is a national issue. It affects patients, it affects communities, it affects professionals themselves. What is our approach, RCDSO's approach? At RCDSO, we believe in a fair process. We believe in supporting internationally trained dentists while protecting the public. In our 2024 report to the Fairness Commissioner in Ontario, almost 50% of the practicing dentists in Ontario are internationally trained. Among new registrants from April 2024 to March of 2025, almost 60% of are internationally trained. So we are making a difference. That is good news. But there's more to do. Our goal is to ensure that there are no unnecessary barriers for those who can demonstrate they meet the Canadian standards. We are working to reduce barriers 3 important ways. Let me share these with you. First is multiple pathways to success. The first way is supporting multiple pathways to certification and licensure. Here is what we know. Internationally trained professionals came from many countries. They trained in different systems. They have different backgrounds. They're not all the same. So we support a common standard measured in different ways. The standard stays high. Patient safety stays our priority. But we recognize that there are different ways to meet those standards. We also allow flexibility for documentation. Some countries are experiencing challenges in producing standard documentation. We understand that this reality. For example, RCDSO accepts alternative documentation from applicants in lieu of certificate of standing where the applicant is unable to obtain one. This may occur in the face of challenging political or bureaucratic circumstances. In this case, we would accept an affidavit from the applicant that contains the relevant details about the registration history in that jurisdiction and confirms that they are in good standing in that jurisdiction, an affidavit from a candidate. Second, quality education and learning. The second way is supporting high quality educational programs and structured learning environments. Many internationally trained dentists need some additional training. This is normal. Every country has different approaches to dentistry. Technology changes, best practices evolve. Let me give you some other examples. Internationally trained dentists can currently participate in several pathways to practice. They can complete a full degree in dentistry in Canada. This works well for some who want comprehensive retraining. These are gap training programs. They are not 4-year degrees. Most of the Canadian universities offer these programs, which are some 2 years and some may have become 3-year programs. They can complete an equivalency program. This is delivered by the national examination body called the NDEB. It is a series of 3 exams. These lead to the opportunity to challenge the final certification exam, which every Canadian dental student has to take as well. RCDSO has an active memorandum of understanding with NDB. We enacted this in 2023. This ensures that service standards, capacity, and processes are meeting colleague expectations. And here is something new that we are excited about. We are actively participating in the development of a new bridge training program. This is for internationally trained dentists who are close to meeting the Canadian standards. These are dentists with strong training and practice experience. This program uses assessments and short-term training modules. It addresses specific needs of particular candidates. The whole program takes no more than 8 months. This is much faster than other options. We want to give professionals options. We want to find the pathways that work best for each person. This makes the process more fair. It makes it more effective. We're also looking at developing a pilot project. This would enable internationally trained dentists to work under approved, supervised settings in Ontario. They would gain practical experience while they challenge one of the licensure pathways. This gives them real-world experience. They will interact with their colleagues and patients and learn how dentistry practices in Canada. It helps them prepare for independent practice. College of Dental Surgeons of Alberta has already started this similar pilot project. And all this information is also on Pegasus webpage. I have personally checked the information, and it is all good information, and people can look at that as well. The third way is promoting mobility between provinces. Canada is one country, though we have different licensing requirements in different provinces. The last speaker mentioned about the having provincial licensing bodies, and I agree with that. In dentistry, we are pretty consistent across the country, and we are always looking to do better. At the national level, RCDSO chairs the multi-stakeholder working groups to review certification processes for graduates of internationally trained dental programs. This group represents all the major provincial and national dentistry organizations. It works to review current programs and to explore potential changes and additional pathways to certification and licensure. We also support provincial government solutions. One example is Ontario's as of right legislation. This means if you are licensed in one province, you can practice in another province. You don't have to start all over again. The Ontario government recently proposed expansion of the legislation to include dentistry, expediting the process for healthcare professionals registered in other provinces or territories to begin practice in Ontario makes sense. RCDSO also works actively with our provincial government and Fairness Commissioner. We want to ensure that barriers are reduced. We want internationally trained dentists to be registered quickly when they have met all the requirements. Our registration committee provides regular reports to government. These reports include data on our performance. I'm proud to say that RCDSO consistently meets and exceeds regulation requirements for licensure. We track our timelines. We measure our performance. We report our results to Fairness Commissioner and provincial government, Ministry of Health. On average, the registration department provides decision on complete applications in less than 5 business days. This is regardless of country of training. Why this matters? You know why this work is so important. First, it is about fairness. These are skilled professionals. They have invested years in their education. They have experience. They deserve a fair chance to continue. Second, it is about meeting Canada's healthcare and oral health needs. Third, it is about economic sense. When professionals can't practice, we waste their skills. We waste their potential contribution. This hurts our economy. It hurts our communities. Fourth, it is about families. Many internationally trained dentists have families. When they can't work in their profession, it affects their whole family. It affects their children's future. I want you to know that we are making real progress. At the RCDSO, we have streamlined some of our processes. We have reduced waiting times in some areas. We have created new pathways. But we know there is more work to do. We are committed to this work along with our partners. Let me close with this thought. This is not just about dentistry. This is about building a better healthcare system for all Canadians. Thank you for the work you do, and thank you for providing me with this opportunity to speak today. Thank you, and I'll be very happy to answer any questions.
Okay, thank you so much, Dr. Sandhu. For the participants online, as well as those in person, if you have any question, please feel free to raise those questions at this time. We still have a few more minutes left to accommodate those questions.
All of that information is on your web page. Actually, what I spoke about various pathways are listed, and I worked with Muhammad. That information is very, very complete.
Yeah, thank you.
Okay.
Thank you very much. I posted that link on the chat as well.
Thank you so much.
Dr. Sandhu there also referencing our IEHP Resource Hub. So the international health professionals in Canada, we also have an online resource hub. And there we post information about the various pathways, and we continue to update that content as well. We're grateful that he was so thorough in going through and reviewing those contents to make sure that there is accuracy in the information that is there. So you remember Dr. Sanders spoke about posting all of these content, posting about these pathways, but then when things change, there's a concern of accuracy and the whole issue of going to update all of that. So we've taken that bold move to post it there with the caveat, this is the most accurate information up to this time. And so we continue to update that to make sure that we're offering value to our IEHPs that come in. And we are really appreciative of you, Dr. Sandhu, and of course, joining us today to address our participants.